Hi guys, I'm Kim Anthony M. Tan, the reporter. Ang communicable disease ay isang nakakahawang sakit. Ito ay sanhi ng isang agent o toxin sa nangyayari sa pamamagitan ng direkta o hindi direktang paghahatid ng agent nito mula sa isang nahawaan na individual o hindi naman kaya sa pamamagitan ng isang hayop. Dengue. Ang dengue ay nakakahawang sakit na sanhi ng lamok na nagmula sa mga nakaimbak na maruruming tubig at karaniwang sintomas nito ay pagkakaroon ng pamumula sa iba't ibang bahagi ng ating katawan, pananakit ng ulo, kalamnan at kasukasuhan. Kapag ikaw ay tinamaan ng gantong uri ng sakit, maaaring bumaba ang iyong dugo at maging dahilan ng paghina ng iyong katawan. Maaari itong maiwasan kung iiwasan natin mag-imbak ng tubig or mas mabuting palitan ang nakaimbak na tubig sa loob ng 7 araw. Iwasan ang lugar na walang ilaw dahil mas aktibo ang mga lamok or gumamit ng lotion o di kaya magsuot ng panjama. Malaria, isang uri ng sakit na nagmula sa agat ng lamok na ang tawagin ay anopheline. Ang kagat nito ay tinatawag na sporozoan parasite. Kapag nasa loob ng ating blood ang parasite na ito, ay makakaramdam tayo ng biglang panginginig, panlalamig at lagnat. Ito ay nakakamatay na sakit dahil sa parasite na nasa loob ng ating katawan ay haharang sa daluyan ng ating dugo. Ang sintomas nito ay lagnat, panlalamig ng katawan, sakit ng ulo, pagdudumi, abdominal pain, muscle or joint pain, fatigue at rapid breathing and heart rate. May iwasan ito sa pamamagitan ng mosquito repellent at pagsusuot ng panjama at umiwas sa maduduming lugar. Kolera, sakit na nagdudulot ng matinding basang pagdudumi na humahantong sa pagkatuyot ng tubig sa ating katawan o dehydration. Kung hindi maagapan, ito ay maaaring humantong sa kamatayan. Ang sanhi nito ay maruruming pagkain at inuming tubig na galing sa gripo at hindi malinis na pagkain. Low blood pressure, there's muscle cramp at panunuyot ng loob at labas ng ating mouth, nose, and eyelids. May iwasan ito kung sisiguraduhin malinis at ligtas ang ginagamit na tubig, lalo na sa paghahanda ng pagkain, inumin, pagsisipilyo at iba pa.
Good day everyone, I'm Michael Gabriel Villarin Quinto and I will be representing communicable diseases. So the first one is avian influenza. Avian influenza refers to the disease caused by infection with avian influenza type A viruses. These viruses occur naturally among wild aquatic birds worldwide and can infect domestic poultry and other bird and animal species. Avian flu viruses do not normally infect humans. Currently, the best way to prevent infection with avian influenza A viruses is to avoid sources of exposure whenever possible. Infected birds shed avian influenza virus in their saliva, mucus, and feces. Human infections with bird flu viruses can happen when enough virus gets into a person's eyes, nose, or mouth or is inhaled. This can happen when virus is in the air and a person breathes it in, or when a person touches something that has virus on it, then touch their mouth, eyes, or nose. Where human infections with some avian viruses have occurred most often after unprotected contact with infected birds or surfaces contaminated with avian influenza viruses. However, some infections have been identified where direct contact was not known to have occurred. People who work with poultry or who respond to avian influenza outbreaks are advised to follow recommended biosecurity and infection control practices. These include use of appropriate personal protective equipment and careful attention to hand hygiene. Additionally, Centers for Disease Control and Prevention, or in short CDC, recommends that people responding to poultry outbreaks should get a seasonal influenza vaccination every year, preferably at least 2 weeks before engaging in an outbreak response. Seasonal influenza vaccination will not prevent infection with avian influenza A viruses but can reduce the risk of co-infection with human and avian influenza A viruses. These people should also be monitored for illness during and after responding to avian influenza outbreaks among poultry. As a general precaution, people should avoid wild birds and observe them only from a distance. Avoid contact with domestic birds that appear ill or have died. And avoid contact with surfaces that appears to be contaminated with feces from wild or domestic birds. If you've had direct contact with infected birds, you should people who have had direct contact with infected birds should watch to see if they become ill. They may be given influenza antiviral drugs to prevent illness. While antiviral drugs are most often used to treat flu, they also can be used to prevent infection in someone who has been exposed to influenza viruses. When used to prevent seasonal influenza, antiviral drugs are 70% to 90% effective. Close contacts, family members, etc. of people who have been exposed to avian influenza viruses are being asked to monitor their health and report any flu-like symptoms. So the next one is H1N1 flu. The H1N1 flu, commonly known as swine flu, is primarily caused by the H1N1 strain of the flu virus. H1N1 is a type of influenza A virus, and H1N1 is one of several flu virus strains that can cause the seasonal flu. The signs and symptoms of flu caused by the H1N1 virus are similar to those of infections caused by other flu strains and can include fever but not always, chills, cough, sore throat, runny or stuffy nose, watery, red eyes, body aches, headache, fatigue, diarrhea, nausea, and vomiting. So, when to see a doctor? It's not necessary to see a doctor if you're generally healthy and develop flu signs and symptoms such as fever, cough, and body aches. Call your doctor, however, if you have flu symptoms and you're pregnant or you have a chronic disease such as asthma, emphysema, diabetes, or a heart condition, because you have a higher risk of flu complications. If you have emergency signs and symptoms of the flu, get medical care right away. For adults, emergency signs and symptoms can include difficulty breathing or shortness of breath, chest pains, ongoing dizziness, seizures, worsening of existing medical conditions, severe weakness, or muscle pain. Influenza viruses such as H1N1 infect the cells that line your nose, throat, and lungs. The virus enters your body when you inhale contaminated droplets or transfer the virus from a contaminated surface to your eyes, nose, or mouth. These measures also help prevent the flu and limit its spread. Wash your hands thoroughly and frequently. Use soap and water, or if they're unavailable, use an alcohol-based hand sanitizer. Cover your coughs and sneezes. Cough or sneeze into a tissue or your elbow, then wash your hands. Avoid touching your face. Avoid touching your eyes, nose, and mouth. Regularly clean often touch surfaces to prevent spread of infection from a surface with the virus on it to your body. Avoid contact. Stay away from crowds if possible. Avoid anyone who is sick if you're at high risk of complications from the flu. For example, you're younger than 5 or you're 65 or older. You're pregnant or you have a chronic medical condition such as asthma. Consider avoiding swine barns at seasonal fairs and elsewhere. So the next one is typhoid fever. Typhoid fever is a bacterial infection that can spread throughout the body, affecting many organs. Without prompt treatment, it can cause serious complications and can be fatal. So, what causes typhoid fever? The bacterium Salmonella typhi causes typhoid fever. The bacteria spreads through contaminated food, drink, or water. People infected with Salmonella typhi carry the bacteria in their intestinal tract and blood. Salmonella typhi is shed in feces. You may get typhoid fever if you ingest food or beverages prepared by someone who is shedding the bacteria and who does not wash their hands properly. In less developed countries, sewage containing Salmonella typhi may contaminate local water supplies. In some cases, people who have previously had typhoid fever still carry Salmonella typhi bacteria. These people are carriers of the disease. They may spread the infection even when they have no symptoms. So, can typhoid fever be prevented? So, receiving a typhoid fever vaccination currently, two vaccines are available to help prevent the spread of typhoid fever. Talk with your doctor about getting vaccinated. And avoiding food that is raw or undercooked. Drinking only bottled water or water that has been boiled. Truly washing your hands each time before eating. Avoiding raw fruits and vegetables that cannot be peeled. And avoiding eating foods and beverages purchased from street vendors. That's all. Thank you for listening.
Hello everyone, my name is Justin Jobert Padpad. I'm with Princess Jasmine Dominog and we're here to discuss about the topic of non-communicable diseases. What is non-communicable diseases? Non-communicable diseases or NCDs, also known as chronic diseases, are not passed from person to person. They are not long duration and generally slow progression. These conditions include hypertension, cardiovascular disease, heart attack, stroke, diabetes, and cancer. So ang non-communicable disease ay hindi siya nakakahawa and we're here to discuss about that condition. Hypertension, also known as high raised blood pressure in a condition in which the blood vessel have persistently raised pressure. Blood is carried from the heart to all parts of the body in the vessel. Each time heart beats, it pumps blood in the vessel. So ang hypertension, tawag rin dyan ay high blood. What are the cause of hypertension? Common factors that can lead to high blood pressure include a diet high in salt, fat, and cholesterol. So, nakukuha ang hypertension or high blood sa pagkain ng mga pagkain na matataas sa salt, fat, and cholesterol. More on cholesterol food siya nakukuha. Two main types of high blood pressure. Primary or essential high blood pressure is the most common type of high blood pressure for most people who get this kind of blood pressure. It develops over time as you get older. Secondary high blood pressure is the caused by another medical condition or use of certain medicines. It usually gets better after you treat that condition or stop taking the medicine that are causing it. So these are the symptoms of hypertension. The basic symptoms of hypertension. So we have headache, asphyxiate, nausea, nosebleed, and throw up. Though you can have hypertension without having any symptoms, the best way to know if you have high blood pressure is to have your blood pressure checked by a healthcare provider. If your blood pressure is extremely high, there may be certain symptoms to look out for, including severe headaches, nosebleed, fatigue or confusion, visual problem, chest pain, difficulty in breathing, irregular heartbeat, and blood in urine. So kung meron kang high blood at lumabas tong mga symptoms na to, may chance na ang high blood mo ay mataas. The best way to know if you have high blood pressure is to have your blood pressure checked by a healthcare provider. So this is the blood pressure category. We have systolic over diastolic. So normal ang 120 over 80, elevated naman ang 120 to 128 over 80. High blood pressure or hypertension stage 1, ang 130 to 139 over 80 to 89. High blood pressure hypertension stage 2, 140 or higher over 90 or higher. And last, we have hypertensive crisis that needs to consult your doctor immediately if this happens. Higher than 180 over higher than 120. How do you get rid of hypertension? Unfortunately, there is no cure yet for primary HBP or high blood pressure. Healthy lifestyle habits can help keep your HBP under control. So first, lose extra pounds and watch your waistline. Blood pressure often increases as weight increases. So ang pag-gain ng weight ay nagkakaroon ng matrigger ang hypertension. Exercise regularly, eat a healthy diet, reduce sodium in your diet, limit the amount of alcohol you drink, quit smoking, cut back on caffeine, and reduce stress. Yes, stress can also trigger a hypertension. Cardiovascular disease. Cardiovascular disease, or CVD, is a general term for condition affecting the heart or blood vessels. It's usually associated with a buildup of fatty deposits inside the artery or atherosclerosis and an increased risk of blood clot. So what are cardiovascular diseases? These are the examples of cardiovascular diseases: abnormal heart rhythm or arrhythmias, aorta diseases, and Marfan syndrome, congenital heart disease, coronary artery disease or narrowing of the arteries, deep vein thrombosis and pulmonary embolism, heart attack, heart failure, heart muscle disease. What is the main cause of cardiovascular disease? A buildup of fatty plaques in your arteries is the most common cause of cardiovascular disease. Unhealthy lifestyle habits such as a poor diet, lack of exercise, being overweight, and smoking, and also family history. Yes, family history. So, pag yung family nyo ay may history ng sakit sa puso or cardiovascular disease, pwede nyo ma-inherit yan through genes. There are several ways you can reduce your risk of developing cardiovascular disease. So first, eat a healthy and balanced diet, be more physically active, keep to a healthy weight, give up smoking, reduce your alcohol consumption, keep your blood pressure under control, and take any prescribed medicine. So what is the example of cardiovascular exercise? So meron tayong exercise para sa cardiovascular. Activities like walking, jogging, running, cycling, swimming, aerobics, rowing, stair climbing, hiking, cross-country skiing, and many more types of activities. And we also have sports such as soccer, basketball, squash, and tennis may also improve their cardiovascular fitness. Heart attack. A heart attack, also called a myocardial infarction, happens when a part of the heart muscle doesn't get enough blood. The more time that passes without treatment to restore blood flow, the greater the damage to a heart muscle. A heart attack occurs when the blood flow to the heart is blocked, and the blockage is often a buildup of fat, cholesterol, and other substances, which form a plaque in the arteries that feed the heart or coronary arteries. Sometimes, a plaque can rupture and form a clot that blocks blood flow. So these are the silent signs of a heart attack. We have chest pain, pressure, fullness or discomfort, discomfort in other areas of your body, difficulty in breathing and dizziness, nausea, and cold sweats. So most heart attack involves pain or discomfort in the center or left center of your chest. This pain can range from mild to severe. The pain may feel like tightness, fullness, heavy pressure, crushing, or squeezing. It can also feel like heartburn or indigestion. So pag umaatake ang heart attack, parang may mabigat sa ating dibdib, mostly on the left side of our chest, which is kung saan nakalocate ang heart, dun sumisikip at parang hindi tayo makahinga. So what is the cause of a heart attack? Heart attack occurs when one or more of your coronary arteries become blocked. Over time, a buildup of fatty deposits, including cholesterol, form substances called plaque, which can narrow the arteries or atherosclerosis. This condition, called coronary artery disease, cause most heart attacks. So, yan yung common cause of a heart attack. How to prevent a heart attack? So first, stop smoking. Second, choose good nutrition. Third, lower high blood pressure. Fourth, be physically active every day. Fifth, aim for a healthy weight. Sixth, manage diabetes. And lastly, reduce stress. Did you know a study in American Journal of Medical Epidemiology found that participants who drink 5 or more glasses of plain water per day have a much lower risk of fatal coronary heart disease compared to those who drink less than 2 glasses per day. So, ang pag-inom ng 5 or more glasses of water per day, hindi tayo matatamaan agad-agad ng coronary heart disease. So, the next 3 conditions will be discussed by Princess Jasmine Luminog, which is stroke, diabetes, and cancer.
Good day everyone, I am Princess Jasmine B. Luminog. First, I'm going to discuss the definition, signs, and symptoms of stroke. Stroke. A stroke occurs when the blood supply to part of your brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. Brain cells begin to die in minutes. Ang stroke ay sanhi ng pagbara o pagtagas sa daluyan ng dugo sa ating utak na nagreresulta sa pagkawala ng ilang pag-andar ng ating utak, tulad ng pagkontrol sa paggalaw ng binti, braso, at pagsasalita. Signs and symptoms of stroke. Trouble speaking and understanding what others are saying. You may experience confusion, slur your words, or having difficulty understanding speech. Ito yung pagkawala ng kontrol sa pagsasalita. Paralysis or numbness of the face, arm, or leg. You may develop sudden numbness, weakness, or paralysis in your face, arm, or leg. This often affects just one side of your body. Try to raise both your arms over your head at the same time. If one arm begin to fall, you may be having a stroke. Also, one side of your mouth may drop when you try to smile. Ito naman ay ang pagkawala ng kontrol o pagmamanhid ng ibang parte ng katawan. Problem seeing in one or both eyes. You may suddenly have blurred or black vision in one or both eyes, or you may see double. Maaari ring maapektuhan ang paningin ng isang pasyenteng nakakaranas ng ganitong sakit. Pagbablurred, pagdidilim, at pagdodoble ng paningin ang maaaring epekto nito. Headache. A sudden severe headache, which may be accompanied by vomiting, dizziness, or altered consciousness, may indicate that you're having a stroke. Maaari ring ang pagsakit ng ulo, pagkahilo ang isa sa mga sign ng stroke. Lastly is trouble walking. You may stumble or lose your balance. You may also have sudden dizziness or a loss of coordination. Ito naman ay ang pagkawala ng balanse sa paglalakad. Seek immediate medical attention if you notice any signs or symptoms of a stroke, even if they seem to come and go or they disappear completely. Think fast and do the following. First, to the face. Ask the person to smile. Does one side of the face droop? Arms. Ask the person to raise both arms. Does one arm drip downward or is one arm unable to raise? Speech. Ask the person to repeat a simple phrase. Is his or her speech slurred or strange? Time. If you observe any of these signs, call 911 or emergency medical help immediately. Ito yung mga maaari natin maitulong sa mga tao na ikitaan natin ng signs or symptoms ng stroke. Diabetes and the three types of this. Diabetes is a chronic long-lasting health condition that affects how your body turns food into energy. It is a chronic disease that occurs when the pancreas is no longer able to make insulin or when the body cannot make good use of the insulin it produces. Ito ay isang karamdaman na delikado sa ating kalusugan na nakakaapekto sa halos buong organ ng ating katawan. Ang listahan ng mga potensyal na komplikasyon ay mahaba at karaniwang nakita sa mga diabetic na may hindi magandang sugar control at hindi sumusunod sa dietary at lifestyle recommendations. Ang karaniwang komplikasyon ng diabetes ay heart disease, stroke, neuropathy, kidney failure, blurred vision, at decreased immunity. Next ay ang the three types of diabetes. Type 1 diabetes can develop at any age but occurs most frequently in children and adolescents. When you have type 1 diabetes, your body produces very little or no insulin, which means that you need daily insulin injections to maintain blood glucose levels under control. Type 2 diabetes is more common in adults and accounts for around 90% of all diabetes cases. When you have type 2 diabetes, your body does not make good use of the insulin that it produces. The cornerstone of type 2 diabetes treatment is healthy lifestyle, including increased physical activity and healthy diet. However, over time most people with type 2 diabetes will require oral drugs and or insulin to keep their blood glucose levels under control. Gestational diabetes is a type of diabetes that consists of high blood glucose during pregnancy and is associated with complications to both mother and child. If you are at a risk of diabetes, you may be able to prevent or delay getting it. Most of the things that you need to do involve having a healthier lifestyle. So if you make these changes, you will get other health benefits as well. You may lower your risk of other diseases and you will probably feel better and have more energy. Losing weight and keeping it off. Weight control is an important part of diabetes prevention. You may be able to prevent or delay diabetes by losing 5 to 10% of your current weight. For example, if you weigh 200 pounds, your goal would be to lose between 10 to 20 pounds. And once you lose the weight, it is important that you don't gain it back. Following a healthy eating plan. It is important to reduce the amount of calories you eat and drink each day so you can lose weight and keep it up. To do that, your diet should include smaller portions and less fat and sugar. You should also eat a variety of foods from each food group, including plenty of whole grains, fruits, and vegetables. It's also a good idea to limit red meat and avoid processed meats. Get regular exercise. Exercise has many health benefits, including helping you to lose weight and lower your blood sugar levels. These both lower your risk of diabetes. Try to get at least 30 minutes of physical activity 5 days a week. If you have not been active, talk with your healthcare professional to figure out which types of exercise are best for you. You can start slowly and work up to your goal. Don't smoke. Smoking can contribute to insulin resistance, which can lead to type 2 diabetes. If you already smoke, try to quit. Talk to your healthcare provider to see whether there is anything else you can do to delay or to prevent type 2 diabetes. If you are at high risk, your provider may suggest that you take one of a few types of diabetes medicines. Next is cancer and its application. Cancer is a disease in which some of the body cells grow uncontrollably and spread to other parts of the body. Cancer can start almost anywhere in the human body, which is made up of trillions of cells. Normally, human cells grow and multiply through a process called cell division to form new cells as the body needs them. When cells grow old or become damaged, they die and new cells take their place. Some types of cancer cause rapid cell growth, while others cause cells to grow and divide at a slower rate. How does cancer develop? Paano nga develop ang cancer? Cancer is a genetic disease it is caused by changes to genes that control the way our cells function, especially how they grow and divide. Genetic changes that cause cancer can happen because of errors that occur as cells divide, because of damage to DNA caused by harmful substances in the environment such as the chemicals in tobacco smoke and ultraviolet rays from the sun. Our cancer causes and prevention section has more information, or they were inherited from your parents. Each person's cancer has a unique combinations of genetic changes. As the cancer continues to grow, additional changes will occur. Even within the same tumor, different cells may have different genetic changes. The body normally eliminates cells with the damaged DNA before they turn cancerous, but the body's ability to do so goes down as we age. Type of cancer. There are more than 100 types of cancer. Types of cancer are usually named for the organs or tissues where the cancers form. For example, lung cancer starts in the lung, and brain cancer starts in the brain. Cancers also may be described by the type of cell that form them, such as an epithelial cell or a squamous cell. Carcinoma. Carcinomas are the most common type of cancer. They are formed by epithelial cells, which are the cells that cover the inside and outside surfaces of the body. There are many types of epithelial cells, which often have a column-like shape when viewed under a microscope. Sarcoma. Sarcomas are cancers that form in bone and soft tissues, including muscle, fat, blood vessels, lymph vessels, and fibrous tissue, such as tendons and ligaments. Leukemia. Cancers that begin in the blood-forming tissue of the bone, marrow, are called leukemias. These cancers do not form solid tumors. Instead, large numbers of abnormal white blood cells, leukemia cells, and leukemic blast cells build up in the blood and bone marrow, crowding out normal blood cells. The low level of normal blood cells can make it harder for the body to get oxygen to its tissues, control bleeding, or fight infections. Tissue changes that are not cancer. Not every change in the body's tissues is cancer. Some tissue changes may develop into cancer if they are not treated. However, here are some examples of tissue changes that are not cancer but in some cases are monitored because they could become cancer. Katulad na lang ng hyperplasia. Hyperplasia occurs when cells within a tissue multiply faster than normal and the extra cells build up. However, the cells and the way the tissue is organized still look normal under a microscope. Hyperplasia can be caused by several factors or conditions, including chronic irritation. Dysplasia is a more advanced condition than hyperplasia. In dysplasia, there is also a buildup of extra cells, but the cells look abnormal and there are changes in how the tissue is organized. In general, the more abnormal the cells and the tissue look, the greater the chance that cancer will form. Some types of dysplasia may need to be monitored or treated, but others do not. An example of dysplasia is an abnormal mole called a dysplastic nevus that forms on the skin. A dysplastic nevus can turn into a melanoma, although most do not. Next is carcinoma. In situ is an even more advanced condition, although it is sometimes called stage 0 cancer. It is not cancer because the abnormal cells do not invade nerve tissue the way that cancer cells do, but becomes carcinoma is situ may become cancer, and they are usually treated. Next is the cancer prevention. First, don't use tobacco. Second, eat a healthy diet. Third, maintain a healthy weight and be physically active. Fourth, protect yourself from the sun. Fifth, get vaccinated. Sixth, avoid risky behaviors. And lastly, get regular medical care.